Okay, welcome everyone joining the webinar on the impact of COVID-19 on public works program. My name is Rodolfo Beasley. I'm going to be the moderator today. This is the 12th webinar of the series on social protection responses to COVID-19 to the COVID-19 crisis, which is a joint effort by IPC-IG, GIZ on behalf of the German government, DFAT on behalf of the Australian government, in collaboration with the socialprotection.org platform. This series of webinars is also complemented with other two strategies covering the issue of social protection responses to COVID-19. One is a newsletter, a dedicated newsletter, which you can subscribe to online, and you can also share information with socialprotection.org to include in the newsletter. And then there is an online community in which we exchange information about social protection and COVID-19, and you can join this community through the website as well. Next slide. Good. Okay, let me briefly mention that next week we're gonna have on Tuesday another webinar on this series, which is gonna be about a very interesting and hot topic, which is identification and registration of beneficiaries for social protection responses to COVID-19. Valentina Barca, Richard Chirchir, and others are gonna be presenting. So I invite you to register online and join us next week. Okay, so now I'm going to start by presenting the speakers of today. We have a great team of panelists. Let's move to the next one. Okay, we can go fast through this. I'm Rodolfo Beasley. I work on social protection, and I'm glad to be joining this webinar today. Next one. So we're going to start with a presentation by Anna McCord, who specializes in social protection design and evaluation with a focus on public works, labor markets, and employment. I'm sure that you have come across with some of her research at some point. And Anna is going to be the first speaker today, and she's going to be sharing some or exploring some challenges, the challenges that COVID-19 is imposing to public work programs, and also sharing some experiences in relation to how these programs have been adapting to this crisis. Next one, please. Then we're going to have the presentation by Devan Pillay, who is the acting director general of the expanded public work program in South Africa, and he's going to be sharing with us the experience in relation to how this program is currently being adapted to perform and deliver services in this context. Next one, please. And finally, we'll have Rajiv Ahal, he's with GIZ India. He's Director of Natural Resource Management, and he's going to be sharing with us the experience of the MGNREGA program in India, also in how this program is adapting to the current crisis. So we have these three presentations by the three panelists, and then after that we're gonna have a Q&A session, in which we're gonna answer to your questions. So please do share your questions through the chat bar that you should have somewhere there on your screen. I'm gonna be sharing those questions with the panelists. Please, if it is possible, do indicate who you are addressing the question to, if that is possible. You can also interact with us on Twitter. Yeah, and that's it. So next slide. Okay, before getting into this, let me also mention that if there are too many questions and we don't manage to answer all of them in the Q&A session, then we're gonna answer to them in writing, and we're gonna share the answers in a couple of days. It's important for us to answer all these questions as much as possible. So as I mentioned, this is one of the webinars as part of the whole series of social protection in response to the COVID-19 crisis. And we developed a framework together with Valentina Barca and Fabio Bea Soares to guide the whole series. And I just wanted to share a couple of comments about that. And we've been trying to cover the different social protection instruments in the different webinars, for example, cash transfer programs, school feeding programs, and so on. And now here we are today focusing on public works. And when we assess, we study the role of public works and social protection programs in this crisis, we focus on two aspects. One is system or program resilience, no? How can the program or the system withstand the shock and guarantee that the regular services are provided in a different context, no? And then, secondly, how these programs can adapt and provide possibly scale up or provide a different type of support in a new context with increasing demands. So resilience and adaptation. Next one, please. And we also try and focus on three dimensions when we assess, in particular, the adaptation of programs, is to what extent these responses are being comprehensive, they are addressing all the risks that people are facing, because one program is addressing all the risks, or because the series of different programs are addressing these different risks. Then, in terms of coverage, to what extent all the population, or what is the percentage of the population that is affected that is being covered by one or by many responses, and then adequacy in terms of to what extent the support provided is adequate to the new context and needs. We are trying to cover these aspects through the different webinars in the series. And with this brief introduction, now I'm gonna ask Anna to give her presentation. Anna, thank you very much.
Thank you very much, Rodolfo. And good morning, good afternoon to everyone. What I'm going to try and do in this first presentation is to give an introduction. Next slide, please. What I hope we can do is explore some of the challenges for people currently implementing and funding public works programs in the context of the coronavirus, which I'm going to be calling C19 for the sake of brevity. Looking at the extent to which there is systems resilience, programs can continue functioning, or where they need to be adapted or have been adapted. And what we're aiming to do in this session is really to share experience of different program implementers and different agencies in developing those program responses, and also share some of the key ideas and materials that are emerging from the major agencies, development partners working on these issues. And in particular, I'm going to draw on a series of blogs which have come from the World Bank Jobs and Development Partnership, which I'd really recommend. They're very interesting, stimulating blogs coming out of there. And I'm also going to draw on some of the guidance materials that have been produced by the ILO in relation to their employment intensive investment programs, because both of these institutions have been trying to develop materials to support people currently implementing public works. So we're not going to exclusively look at those materials, but I am going to draw on them. Next slide, please. And I think it's really useful for us just to situate this within the whole C19 crisis. And I think what's critical here is that C19 has already had a massive adverse impact on the global economy. And while it was initially perceived as a health crisis, and responses were very much looking at it from that perspective, it's created a major global economic shock. what we're seeing, the latest estimates from the IMF are that globally growth is going to contract by 3%. And that's looking to be more severe in more developed countries, going back by perhaps 5 or 6%. But it's also estimated that there will be contraction throughout the developing world, Sub-Saharan Africa and South Asia in particular. What this means is that there's an anticipated rise in global unemployment by about 25 million. That's the figure that the ILO is putting forward. And this is actually worse than the impact on unemployment of the financial crisis of 2008. And when you put this in a context where you already had quite a high proportion of workers working formally and informally who were living below the poverty line, this is obviously going to have a severe impact on employment, formal and informal employment, and poverty. And the latest estimates from the bank are that we can expect to have an additional 49 million people living in extreme poverty. Next slide, please. So what this means is that there's an increased need for social protection provision due to the suspension of economic activity. So there was already a large unmet need for social protection, but what we see is a significant increase in the need for social protection now because so much economic activity has just been suspended. And in addition to the normal group for whom social protection has been developed in low and middle income countries over the last decades, which was the unemployed informal workers, we also now have the caseload of unemployed formal workers. Perhaps they had access to some kind of social security, but for the majority of workers, this was not adequate. And even before the crisis, 80% of workers globally did not have access to social protection. So what we can see is that before the crisis, we already had a major challenge for extending social protection, but now that challenge has expanded significantly. And countries have been very rapid to respond to this crisis. And an excellent overview of development, social protection developments in response to the crisis is put together by Ugo Gentilini at the World Bank each week. And the latest figures indicate that 180 countries have already come up with new social protection measures to respond to the crisis. And they've detailed 870 new interventions or adaptations of existing programs. Now, the primary response is an expansion of cash transfer programming, in-kind grants and subsidies, but there have also been a number of adaptations or innovations in relation to public employment programs, public works programs. And the World Bank has so far documented 13 different responses in 10 countries. Next slide, please. And if you're interested in getting more information on the specificities of those countries, you can follow a link which is available on the socialprotection.org C19 site. So what I'd like to do is focus now on the public works response to C19. And what we see is that public works programs are experiencing twin pressures, which really affect resilience. The one pressure is the need to adapt existing programs in response to the risks associated with C19. So that's an adaptation of existing programs in order to protect the workers. But the other is a pressure to expand, to rapidly expand employment provision in response to the decline, this massive decline in formal and informal employment. And so what we're facing as people working in this sector is a need to consider how best the design and implementation of PWP can be configured in response to C19. And this is both a short-term issue, but also a medium-term issue, because it's very clear that the medium-term economic impacts of the C19 crisis are going to be severe, and they can be expected to prevail for between 5 and 10 years. So we really need to be looking both in the immediate term, but also in the medium term. Next slide, please. And so perhaps it's best to think of two phases of the public works response. The first is this question of the immediate health crisis, and the World Bank has referred to this phase as pandemic adapted public works, PAPW. And so in this immediate period, we need to address the contagion challenges, address the immediate employment needs, and then see if public works can actually help to address some of the health aspects of the C19 crisis. So that's the first phase. But the second phase is really looking at this question of expanding public works to deliver mass social protection in the context of a sustained economic crisis. And how can public works contribute to macroeconomic stabilization and a demand stimulus function? And we're going to look at briefly look at these different phases of response. Next slide, please. If we're looking at the implementation challenges, the primary one is this issue of contagion risk during ongoing public works operation. And this is the question of resilience. Can programs continue to be implemented during this phase? And I think the key issues which have emerged are the need for those implementing public works programs to really consider the principles of duty of care and do no harm, and consider how they can actually protect workers. And the main responses that we've seen to enable public works to continue are very much linked to the provision of PPE, personal protective equipment for workers, incorporating social distancing into programs, and shifting the focus away from the production of public goods or community goods to the production of individual or household goods. So, for example, focusing the programs, changing their focus onto household level activities. Next slide, please. And the ILO has come up with a very useful document which actually looks practically at how you might adjust your public works practices in response to C19. And I've given, I think the reference for this is being shared in the chat, but it's also on the presentation and you'll find it on the socialprotection.org site. And the ILO comes together with this very useful checklist of planning, project implementation, awareness, promoting water and sanitation, and PPE, and goes through each of these aspects of implementation and clearly sets out what you might need to consider, what the changes might be. Some of the more interesting issues are looking at how you actually help people to deal with sickness and quarantine, and looking at perhaps new payment modalities to cover them during these periods. It looks at the question of how you might incorporate health insurance into programs. It looks a lot at communication and awareness raising kind of issues. So I'd recommend you very much to look at this very practical document when we're talking about how programs can be resilient and be adapted to C19. Next slide, please. And then if it's not possible to ensure that the duty of care is maintained within a public works program, then actually the resilience options perhaps are not there, and there needs to be an alternative approach, such as suspension of public works. And you've seen this in a number of countries. In some countries, the program has been entirely suspended, but elsewhere the work requirement has been suspended and the wages are still being transferred, recognizing that this is an extraordinary situation, so there needs to be quite a radical response. And in some programs, the workers have actually been shifted onto cash transfer programs and out of the public works program. So the workers themselves, the caseload of workers, have actually been transferred into another program to ensure that they get ongoing support, but without the requirement to continue working. Next slide, please. Now, the second part of the response is really system adaptation. How do you adapt a program to respond to the changing needs? And here we can see a number of different adaptations have been made in the last few months in public works programs. One is increasing the wage, and I think we'll hear a little bit about that, a little bit more about that in the NREGA presentation that's to follow this. This vertical expansion, actually paying more to workers, recognizing that they're going to have to support more family members, recognizing that cash transfers are shared within households and within communities. So by increasing the wage for those workers who are still working, you can get more resources into the community. The second is horizontal expansion, increasing coverage, and programs have addressed this differently. Some have actually increased the numbers they're employing at each work site, or increased the numbers of people they're employing in each existing project. Others have extended geographical coverage, so they've taken the particular public works model and expanded it to new districts or new states within the country. And something else we've seen recently is an expansion of programs into the urban environment, because what we're seeing as a result of C19 is an expansion of urban unemployment, with the loss of formal sector employment and informal employment opportunities in urban centres being particularly problematic. And so this urban expansion is an attempt to address these newly unemployed people, or people whose livelihoods opportunities have been significantly undermined. So this is taking the ideas from existing rural programs and transplanting them into urban areas. So these are the main axes through which programs have actually been extended. Next slide, please. Then the next issue to do with adaptation is looking at how you can change your programs to provide a health response. So actually, how can you make public employment programs have a health function? And what you've seen is a number of innovations globally. In one country, a public works corps has been created to assist epidemiologists with contact tracing, helping to set up drive-through testing sites, carrying out infection control in nursing homes and homeless shelters. Public works employees have been used to make masks. In other programs, workers have been redeployed for community support functions. And what we're seeing there is things like distribution of soap, hygiene education, creating hand washing facilities for those who don't have access to piped water, disinfecting high-risk areas, and conducting cleanup campaigns. And also we've seen public works programs which focus on household level disinfection and sanitation. Next slide, please. And what we've seen is that some programs have been specially developed to help those who can't work due to quarantine. So short-term public works programs, which have enabled people to collect a public wage, a wage from the public employment program, through carrying out activities in their own homes. So for example, this is short-term, just during that 15-day quarantine period, when you can get an income from disinfecting or improving sanitation in your own homes and neighborhoods, perhaps offering childcare for those who aren't able to care to their children due to the epidemic, carrying out food distribution activities. And elsewhere, public works are actually being used to build medical infrastructure, which is particularly interesting because this will have a sustained benefit beyond the C-19 period. But also what we know is that C-19 exacerbates existing vulnerabilities to other health threats. So by investing using public works labour to build medical infrastructure, you can be helping to manage those additional health risks. Next slide, please. And it's very interesting that the World Bank has drawn out some lessons from the Ebola crisis, which I just wanted to share with you briefly. What happened during the Ebola crisis was that Cash for Work was used in Ebola hotspots to provide infrastructure to get access to patients and to create strategic transport corridors. And Cash for Work was also used in order to be sure that the workers could get access to the people working on the programs should have protective gear and chlorine-treated water. So not only was the Cash for Work improving the ability of the medical service to reach the workers, but to reach those who are sick, but also the workers were provided with PPE. And I think it's interesting to see how we can learn from that Ebola experience. Next slide, please. So yeah, I think those are some ideas about resilience and adaptation of existing public works programs. But I think the other key area, the second phase of public works response to the crisis, is really looking at how they can be used in response in the medium term. And what we've seen is an ongoing transition from a global health crisis to a global economic crisis. As I mentioned, we are already seeing, and we can anticipate further massive rises in unemployment, with the attendant risks of social and political as well as economic destabilization. And large-scale public funded employment is one policy option to address two key objectives in this context. One is social protection to enable ongoing consumption smoothing, but the other is macroeconomic stabilization. And in this way, public employment programs can function as a kind of demand stimulus and perhaps limit the economic crisis. And for that reason, there is really an increasing interest in mass public employment among donors and government actors. Next slide, please. And I just wanted to share with you the findings from some research that I've been doing over the last year with colleagues at the ILO. And we've been looking at the use of public works programs over the last century. And I think many people are familiar with the United States New Deal public employment program which was developed in reaction to the Depression of the 1930s. But at this time, similar programs were implemented in 30 countries right around the world, in all the continents of the world. And the ILO carried out an analysis and a synthesis of these kind of programs to try and learn how they might best be used to address global recession during the 1930s. And they actually came up with public works policy guidelines and set up an international commission on public works, recognizing that addressing this global economic and employment crisis was really a major destabilizing risk. But unfortunately, their efforts were interrupted by the Second World War. But I think it's very interesting to see that at a similar point of global economic crisis, there was a great interest in looking at whether these instruments could be used, and actually a significant implementation of these large-scale public employment programs. You saw this again during the Latin American financial crisis of the 90s, with several programs developed, notably in Argentina during this program, to promote very large-scale employment. And again, in response to the global financial crisis of 2008. And previously, the kind of expansionary fiscal stance that was required to support these large-scale programs was quite contested. But I think the ideological content of expansionary fiscal policy is less important now. And we see that it's becoming much more mainstream in the context of C19, because there's a recognition that mass state expenditure will be necessary for economic and social stabilization. So I think that means that this is quite an interesting point to start thinking about those lessons from large-scale public employment programming in the past. Next slide, please. And I think if there is an interest in looking at how large-scale government-sponsored employment can be put in place, now is actually the time to start thinking about it and planning public works responses to this emerging economic crisis as part of the both macroeconomic and social protection response. And I was interested to note in some of this blog material coming from the World Bank, a statement that prudent governments will use the first phase of the crisis to get public good work projects with strong health standards shovel ready for when the initial viral explosion has been contained. And I think that's a very nice summary of where we are. This is the time to be thinking about how these programs might be implemented, and to start conceptualizing them and getting them, as the World Bank says, shovel ready. But the key question here, if we're looking at a public employment response to the crisis, is how can labour be absorbed efficiently? And I think this is a very interesting point in time, because over the last few years, there's been a great deal of a resurgence of interest in this concept of the Green New Deal. It was first put forward by the UN Environment Programme in, I think, about 2008. And the idea was to look at how there could be mass investment in environmental climate adaptation programming and infrastructure in order to address the current environmental crisis. And I think, look, if we're thinking about public employment programs, it's also a good time to bring in this thinking from the whole Green New Deal concept. And the ILO has in fact been taking forward quite a bit of work in this area, looking at how one might address environmental programming through public employment programs. And I'd refer you to the Green Public Employment Program literature, which the ILO has been putting together. So I think the Green New Deal ideas are very important to consider in relation to this kind of macroeconomic stabilizer function of large-scale public employment. But really, we need to be thinking more broadly about extending options for employment through innovation in public employment programs beyond infrastructure. And you've already seen quite a bit of innovation, particularly in the EPWP in South Africa, which we'll be hearing about later, where they've looked at creating employment in the social sector, the health sector, and also already in the environmental sector. Next slide, please. And interestingly, I just wanted to share with you one other potential area of innovation, which is digital public works. And this is something that the bank has put forward that I thought it'd be fun just to share with people to start thinking about. They argue that information and communication technologies have expanded massively over the last decade, with 47% of the population in developing countries having internet access. And even in least developed countries, access is about 19%. And so they're thinking about the option of developing digital public work. So again, expanding public employment beyond traditional physical infrastructure. And this might be appealing to young people who are going to be bearing the brunt of this economic crisis and also have a greater affinity for digital technology. Next slide, please. And the bank are thinking about some of the opportunities that this could provide, blue sky thinking about what opportunities this could provide. And they're talking about home-based work opportunities for the urban poor. Clearly, this is interesting in the context of C19 because it would be consistent with physical distancing requirements. And it could also address some of the gender constraints to out-of-home working. And they've talked about ideas such as digitization of public records, digital public services, digital tracking of C19 contacts, digitizing health records. And so I think this is a very interesting area just to throw into the debate. They've also spoken about the fact that digital technology could facilitate home-based manufacturing, particularly now we have these kind of new production possibilities, and perhaps the distributed production or assembly of PPE with remote supervision. So I think this really is a time to start thinking more broadly about how public employment could be used innovatively to respond widely to this crisis. Next slide, please. So I'd just like to conclude. What I've done is very briefly set out some of the challenges for public works implementation, looking at resilience of systems and looking at adaptation of systems. I've given a brief overview of some of the innovations and thinking by different governments and development agencies about how public works might be used to address the immediate crisis and respond to the impending global recession and social protection crisis. And I think it's clear from the literature and from looking at what's happening that public works do have the potential to be a significant instrument to contribute to mass social protection provision, macroeconomic stabilization and economic recovery. And it's a role that they have played in the past. But that if this role is going to be taken on, it will require significant investment in planning, cross-sectoral policy coordination and large-scale financing. Thank you very much.
Thank you, Anna. That was great. Thank you for sharing with us the implementation challenges, the challenges in terms of adaptation, but also highlighting the medium-term role or potential role for this program, and also areas of innovation. Thank you about that was great. Okay, so now we move to our next presentation. Let me invite Devan Pillay from the Expanded Public Work Program in South Africa, who is going to be presenting. Devan, are you there?
Yes, I'm here. Good afternoon, everyone, or good morning, it depends where you are. This EPWP presentation is basically a response by the Expanded Public Works Program to the COVID-19. And I've tried to keep it very brief, just focusing on precisely what we are doing in terms of EPWP to respond to the COVID-19. So I'm hoping to keep this within 15 minutes, and I'll try my best to do so. Next slide. Next slide, please. Okay. Just to give you some background on EPWP. The first is it's equivalent to what's globally known as either public employment programs or public works programs. It's synonymous. It's exactly the same as that's been implemented by other countries, with a bit of a variance. So it's basically state-sponsored employment for those that are in the working age group. And this response is as a result of what we consider to be structural challenges within the economy and the inability for the economy to absorb the large numbers of unemployed in South Africa. So this program started around 2003, 2004, and has been running ever since across what we consider 4 sectors. And these were where we thought we would be able to absorb large numbers of unemployed people. And the 4 sectors are the infrastructure sector, which looks at roads, dams, major infrastructure projects. It also looks at smaller infrastructure projects such as maintenance, etc. Then you've got the environment and culture sector, the social sector, and the non-state sector. And essentially the non-state sector looks at working with NPOs to empower NPOs so that they could meet community needs at a grassroots level. I will give you detail on some of these sectors towards the end of the slide and contextualize some of our programs that we're intervening in terms of COVID-19. But the crucial point is that EPWP key objective is to reduce poverty. And we do this through providing meaningful work. It's either in the form of an delivery of an asset, or the creation of a service, or the provision of a service. And EPWP participants in this regard earn a wage. And the target is obviously the poorest of the poor households in South Africa. Next slide, please. In terms of the funding mechanism for EPWP, there is no specific budget that's been allocated for the project. Government departments, through their annual budget allocations, are required to identify opportunities that can be created through the various activities and the various line functions. And the budgets are then used to create work opportunities. So essentially, the creation of EPWP is mainstreamed into every government department and municipality in the creation of these opportunities. So to complement some of what we consider equitable share is the actual budget that a department or municipality receives. In order to supplement that and to encourage greater labor intensivity, the National Department of Public Works provides grants to those provincial departments as well as those local governments that have performed extremely well. Next slide, please. Now, zooming into COVID-19, many of you may know that South Africa went into a lockdown as of the 26th of March 2020 at 12 at night. And in response to this lockdown, I think many of us were caught on the back foot as EPWP because we were not geared towards responding to this. Now, essentially, the lockdown meant that no one could leave their houses. They could economic activity came to a stall, except for what was considered essential services. Now, soon after the lockdown, we've realized, and as demonstrated by Anna's presentation, there's going to be a massive increase in unemployment post the lockdown. There's going to be a significant decline in economic activity, and I think the greatest challenge we will find is the low survival rate of SMMEs. So in developing a response for EPWP towards COVID-19, we had to bear this in mind. So in terms of from a structural perspective, as well as from a depth perspective, we're looking at significant changes within EPWP. What emerged though soon after the lockdown was there was a demand for EPWP services across the whole of government. And we were caught at that point in time with many of the citizens concerned of being infected and didn't want to actually participate in EPWP activities. So in this regard, we've regulated the EPWP response, and we had to keep it within the mandate of any implementing body. So you would find that at local government, they could perform certain activities, while at provincial governments and national government departments, the activities that they had to be linked to their to the department's mandate. So the reasons for the sudden increase for EPWP was the flexibility in which to mobilize EPWP participants. The participants could be drawn very quickly at a community level to respond to exactly what's needed within a community. What was key was all of the functions that we identified had to be temporary in nature. And this supported government's response in that during this period when a number of households' incomes would have been reduced due to the lockdown, we were able to enhance the income of the poor households by the provision of EPWP work opportunities. Now, just to give you an example, as I mentioned earlier, what EPWP is implemented by departments and it's aligned to their mandates. The response to EPWP initially varied, and this varying was as a result of the uncertainty on how EPWP programs are to be rolled out. So as a key thing as part of the regulation that we introduced was and it's required by EPWP, regardless whether it's COVID-19 or not, is to provide PPEs. But what made it especially difficult during the COVID-19 response was the scarcity of PPEs and the sudden spike in costs related to PPEs. Now, we've identified a plethora of activities for EPWP across the sectors. And next slide, please. So having identified this plethora of activities, the one thing that we had to be certain of was not to displace or substitute permanent workers. And this was very crucial and very sensitive and had to be dealt with by unions. And we engaged unions during this process. And relevant departments had to do the respective engagements when employing EPWP participants. Now, initially when the lockdowns started, many departments were, as I mentioned, were not geared to it, but we realized that there was certain activities that needed to be addressed, particularly geared to the health sector. And these entailed cleaning of public spaces, and these such as taxi ranks, bus terminals, clinics, municipality offices, certain government departments, certain government services such as the police stations, courts, etc. And what we found is certain provinces were very proactive, and immediately after the lockdown, they already instituted these activities, and these were performed by EPWP participants exclusively. At the same time, we noticed there was a demand for quarantine sites, and this was linked largely to South Africans that were abroad that were returning to the country. And the initial thinking was that we should use EPWP participants to assist at quarantine sites. After further engagements and considering the environment, we reversed that decision because of the risks that EPWP participants may be exposed to. So we've currently limited the quarantine sites to health professionals, but having noticed more recently that the need to absorb the unemployed, we've now begun to explore the opportunity of using EPWP participants for specific activities within quarantine sites. Next slide, please. So to further enhance on the initial response, government worked on what was considered a hygiene strategy that it wanted to roll out throughout the country. And EPWP participants in this regard were specifically targeted. Ideally, so as they were located, they were able to conduct the education in the locations that they are recruited from. So it'll either be a township or it'll be a ward. And in addition to that, they were requested to assist in what we considered public health centers. Now, the public health centers are basically your clinics where you would have people that are sick that just come in, but also COVID-19 specifically related activities such as screening, tracing, etc., takes place from what we consider public health centers. So EPWP participants were also being geared now to assist in this response. Just on the screening initiative, we were looking at something over 30,000 participants that were drawn in through an EPWP program called Community Health Workers. Now, post the lockdown is where we are currently extensively consulting on and trying to develop papers so that we can begin to absorb the high numbers of unemployed that will emerge. So in addition to the above, you've got cleaning of schools. This is a specific project that we're looking at. It's over and above what is currently being done. And we're looking at recruiting roughly around 100,000 participants for this activity nationally. Now, when schools open, we realize that we have a high concentration of students per classroom. Now, due to social distancing, classrooms will probably need to be broken up and more space being created. So currently the Department of Health, Basic Education is working on creating and building more classrooms. So we find that there would be a need for teaching aid going forward. We've also identified that within quarantine centers and within certain public facilities, there may be the need for minor maintenance work to be done. Simple things such as changing of globes or connection of a burst water pipe, or connection of a dripping, fixing of a dripping tap. And we've identified that we could get EPWP participants that have academic qualifications but are looking for practical training on board to undertake these activities. Now, this looks at, we currently have something called the NYS in infrastructure, which does practical training for artisans. So we're looking at significantly expanding that area of EPWP. The other broadest areas that we're looking at is, and across the all four sectors, we're looking at one, expanding the existing projects that that are being implemented, and we're also looking at identifying new projects. Now, the new projects that are coming through are simple things that we have not considered previously, such as issues of fencing and cutting of grass in certain areas and maintaining forests, etc. So some of the new thinking is still emerging. They have to be labor intensive, and they have to be meeting certain requirements. And amongst this is ensuring that the participants that are recruited don't necessarily have to travel too far to the place of work, as you don't want an erosion of their salaries or the wage they earn through travel costs. Next slide, please. Now, many of you may know that in South Africa, we have something called the National Command Council that's headed by the Deputy President, the President. And there's a committee of senior government officials that are driving the responses to COVID-19. In the last few days, a decision was taken that EPWP participants will assist in the following key areas. It's public health containment. So some of the areas I've already mentioned earlier. The focus will be on cleaning and disinfecting public spaces, to some extent quarantine sites. A very large chunk of EPWP participants will be involved in community awareness campaigns. So this is basically looking at activities where people don't have taps or piped water, to help them build what we consider tippy taps. So also to teach them how to maintain, to remain hygiene, how not to spread the infection, etc. They'll be responsible for, under the screening initiative, to assist with data capturing, data reporting, and triaging. From a social impact perspective, we're looking at increasing the number of EPWP participants to undertake administrative support across government, to undertake security activities in schools, as I mentioned earlier, to assist with cleaning activities, and also now to expand within the social sector the caregiving activities, so that it frees up mothers that are stay at home. If they wish to look for a job, they have a safe place where they can leave their kids. The economic impact is something that has been extensively engaged on. We have something called the infrastructure-led economic growth. So we're looking at how we build in labor intensivity within that. We're working with the ILO. Some of the activities and I've mentioned here are things that we're looking at to increase the opportunities for EPWP participants. One of them is reviving what we previously implemented called the Solar Water Heaters Program, where EPWP participants were trained on how to install solar water geysers in households, and also to maintain that. Youth and environmental services, this is a massive project. It crosses across a number of environmental areas. So there's a focus on expanding that program. Under enforcement, we're looking at, and this program exists to some extent across the country, but it's focused in specific provinces, which is assisting the South African Police Service with certain activities. So this could be simple activities such as doing patrols, assisting at police stations to free up police officers to actually do policing functions. It involves running campaigns within communities on GBV, on violence, on youth programs, etc. Next slide, please. Now this is just a snapshot of what happens under what we consider the non-state sector, which is the NPO programs. I've touched on this earlier. The two key programs that are under the NSS is the non-profit program, which is run by DPW itself. This is where we contract NPOs directly to assist at a community level. As we speak, the Expanded Public Works program itself has just recruited 25,000 EPWP participants to assist the Department of Health with its educational campaigns. We are currently working with the Department of Basic Education on recruiting 100,000 participants, as I mentioned earlier, on the cleaning activities. The Community Works program likewise works with NPOs. This program is still gearing itself towards responding to COVID-19. It's simply because programs are developed a year in advance and budgeted a year in advance. Now, once COVID-19 hit, these programs had to be changed, and they need to go back to the community level and identify what the communities actually require, and then gear their programs accordingly. So this program is currently being finalized, and we're having an engagement with them on that tomorrow on their direct response. Next slide, please. Now, this is some of the, I've just flagged in here some of the key programs that can be employed by the different sectors. So programs that are, and these are programs that we are currently looking at expanding. So this is home-based care. This is where EPWP participants assist frail persons. They either get medication for them, or they physically go to their houses and take care of them for a little while each day. Early childhood development, this is, as we all know, but the problem you have here is most of our schools are closed, but once they're opened, the ECD program will then start taking off as originally planned, and the scope of expansion is currently being explored. On the facility assistance program, I've touched on that. The extra school support, this is where we think we can have a major impact. This is where we support school kids with a number of activities. It includes assisting them with their homework all the way to sporting activities. So there's currently discussions within the Department of Social Development and the other sector departments such as sport to consider budgets for this expansion. As I've mentioned, it's not just for COVID-19, but it's the impact for COVID-19, which is to absorb the massive unemployed that may arise. And next slide, please. On the infrastructure sector, I think I touched on the NYS project. That's where we got youth that are being trained for artisans. The Vukapila Learnership Program, there's some potential in here, but there's not too much for expansion. It's because of the cost drivers linked to this program. Where we find that we'll possibly be able to have major impact is what we consider provincial roads programs. These programs have the ability of creating up to 60,000 work opportunities per province. Currently, we're only running this in about 3 provinces. We intend to expand this over to the remaining 6 provinces. On the environment and culture sector, is the possibility of expansion under the tourism sector right now is limited because all tourist activities have come to a halt. But on the environment and culture sector, there is huge opportunity that exists for expansion along waste management, sustainable energy, parks and beautification, and along the coastal management program. So these programs are now being budgeted for further expansion. Next slide. I think that's the end of the presentation. Thank you.
Thank you, Devan. That was a fascinating presentation, highlighting many implementation and practical details of how the EPWP has been and is being adapted. Now let me invite Rajiv Ahal from GIZ India. Rajiv, okay, over to you.
Thanks, Rodolfo. Good evening to everybody from India, and good morning and good afternoon to other people around the world. We will be sharing the experiences in India from a social protection program called Mahatma Gandhi National Rural Employment Generation Program, which we as GIZ work very closely as Indo-German cooperation with Ministry of Rural Development, the key holder of this program nationally over the last 6-7 years. And this presentation is on behalf of my team of about 15 people who work closely on this. Next slide. So if we look at what's happening vis-a-vis the COVID impact in India, as we are now into our almost 7th week, we are into now 100,000 positive cases, rising sharply with about 3,000 fatalities, which has been quite low given the numbers. We've been in a lockdown since March, and this came suddenly, as also shared by other panelists as well. And for the time being, the lockdown will continue to the end of this month. And then different state governments, and there are something like 35 federal entities all over India, which will take their own decisions on how much to open or what. Now, there has been an economic stimulus package that the central government has just rolled out, which is worth about 253 billion euros. It's called Atmanirbhar Bharat Abhiyan, and it's still being expanded. But these are things that will take some time to reach out and impact people. Therefore, the use of social protection programs is something we would like to share. Just a quick one on the right-hand side, you see a national app created called Arogya Setu, which means a bridge for health. It's a mobile app which the government uses to track cases and for people to track each other. And already with the 1.3 billion people in India, there's already been 100 million downloads and users of this as we go forward. So this is how the COVID response is being looked at, and immediate responses have started happening. Next slide, please. Now, what is MGNREGA? So this was started in 2005. It's actually an act. So it started with a perspective of providing food security to areas in India with embedded poverty. It looked at enhancement of livelihood security of the household as a unit in rural areas. So focus is really rural. And the idea is to provide up to 100 days of guaranteed wage employment every year to whichever household which comes forward to claim work. So it's a self-targeting scheme. And as we will see, it's been there for quite a long time. It has evolved from being a social protection measure with food security, then livelihood development, then asset creation, and now also working on how to look at the COVID response and the immediate impact of it. The next slide, please. Now, I think it was important in India that if a regular option to a huge number of Indians who in the rural areas, almost 70% farmers who are living off rain-fed agriculture, have only 4 months of crops, a huge number of laborers working in fields, and lots of landless people as well, despite the best efforts. There had to be a credible program with a budget line so that the regularity and the access to this sort of an option is there and people can build their lives around it. So the MGNREGA so far in the last 13 years or 14 years has spent already 67 billion euros. So it's quite a big scheme, as you can see. In terms of coverage, it reaches out to 138 million families. So if you multiply that by 5, it's almost like 40% to 50% of India. And out of this, 71 million families are active workers, that while 138 million have registered, more than half are actually actively using it year on year. The interesting thing is who does the work, who has accessed it most. So almost 55% of the person-day use is by women, and therefore this stabilization to the rural household economy and also stopping local migration and seasonal migration, the role has been quite important. We also have socioeconomically vulnerable sections in our society, the tribal groups, the scheduled castes, and other marginalized communities. And 20% of the workdays are generated by them as well. The interesting thing is that almost 65% of this money is actually spent on assets that are directly related to environment and water assets and rejuvenation. So in a sense, what Anna talked about, the Green New Deal, is somehow already a part of an MGNREGA strategy and a plan. And the important thing is that within its own budget, it hides a budget also to roll out and provide a 200,000 strong force of technical and administrative people to take it all the way from national to state to district to block to panchayat and village level to really roll out to these millions of people that we're talking about. Next slide, please. So what has been NREGA's response to COVID-19? So here you're seeing that even though desilting work has to be done, they have carved out areas of more than 1 meter, and the idea is to wear masks and stay a little away from each other. Next slide, please. Yeah. Now, the first thing that MGNREGA started telling the millions and millions of workers, the self-employed, the wage seekers, is that the social distancing has to be maintained. So IEC material, various ways of training them, various ways of working on works which needed people to come together, had to be developed, had to be trained on the ground, and this is still going on. The focus, so there are 2 focus areas largely. One is on the public assets, so you look at common lands, forests, revenue lands, and you develop infrastructure and resources in that. Or for certain sections of the population, especially the vulnerable families, women-headed household, elderly-run households, scheduled caste and scheduled tribe-run household, they always are allowed to do a bit of work on the individual farm ponds, farm fields, horticulture. So now MGNREGA shifted for this period as a response to COVID, most of its effort onto individual infrastructure so that people don't have to go far, don't have to go out, don't have to meet others, and are able to do these things. The other interesting thing is that though every year there is an increase in average wage rate because of the agricultural price indexing, but this year a change was made. It was connected to the consumer price indexing, and the average rate shifted from 2.2 last year to 2.44, which in rupee terms and over 100 days is not bad. It's quite a big amount. Just so lockdown happened in March end. April was the worst time possible, and we'll show you the bar chart later. Yet 1.76 million person days were generated, leading to an infusion directly of 1.2 billion into rural areas. Now, this is stabilization of a rural economy through people working hard also to create medium and long-term assets for further resilience. So in a sense, it's a cash in hand, but also we're getting returns in terms of assets. Now, the biggest challenge, and we'll just share this also later, is that this shutdown had a huge impact on the small and medium micro industries. You find it surprising that almost 70% of India's industrial production happens through SMEs. They employ up to 80% of India's workforce. So as soon as the shutdown happened, the urban and the manufacturing economy shut down, the construction industry shut down, most of these people who had all come from rural areas have now started going back and are halfway between already being back or having reached back. So there's a huge new load, and the focus then is what to do with them, and we'll discuss that a little further. From the last year, because of the processes of also making sure that the works have actually happened, all the approvals are in place, and only then payment should be made, there's been some delay in payment of wages. So the first thing the government did is, without any further ado, the entire backlog of wage payment was released immediately to the states and to the people. Next slide, please. Now, what has the government started doing? So, apart from the normal, an additional 4.8 billion because of the COVID pandemic has been added to this year's budget. So now the state governments and local governments can access up to 12 billion euros worth of financing, around 261 works, which are across all types of possibilities. The idea, what is estimated is that this would lead to about 360 million person days of work being created this year. The idea would be to, and the focus now, and we'll again come to this again. So this is March, April. The winters are finishing. The winter crops are in. COVID pandemic has hit. Field preparations for monsoon plantation were to take place. As soon as now, I'm sitting right now in 45 degrees centigrade in Delhi, and it's the same temperature in most parts of India. This would be followed by, COVID is followed by droughts, and then immediately in the rains by floods. So therefore, the focus is to totally go for water conservation works, work in terms of water saving as well as water management for floods. And this is going to be the focus of the major investment. Usually the MGNREGA works were sort of slowed down in monsoon months to also allow people to work on fields, on other people's field, and get labor from there. So in this case, it has been decided to also allow MGNREGA wage work during monsoon period if people don't have work. And as I shared initially, a lot of IC material and guidelines are being planned. Now, if you see on the right-hand side, Karnataka is one of the states. It's already planning 130 million person days of work. ILO has already done its own assessment, and it has come out clearly that MGNREGA will help in a major way mitigate the COVID crisis. So an instrument created 16, 17 years back has helped with other shocks as well, demonetization, hurricanes, and now COVID-19. The third one is more about simplifying the process. So now that these migrants come back, they may not have the papers with them. Earlier, there was a very strong and a way of checking your antecedents before you were given a card, but now that will be relaxed, and just their self-attestation that I need work would be enough. And of course, the masks and social distancing are in place in varying degrees in different states, I must say. Next slide, please. Now, this is interesting. So if you look at this, this bar charts, on the left-hand side is the number of person days created. So if you see April 2019, the first great bar, it is around 21 million person days. And if you see this year, the gray bar, the third one, it is down to about 12 million person days. So you can see how immediately, initially, with the impact of COVID, everybody was caught unawares. People were in lockdown in their homes. The district administration was still trying to figure out how to get this going. And if you look at the red bars here, in May of last year, we had about 25 million person days of work being created. And look, if you look now, already it has crossed about 27 million. So the interesting thing is a jump of 43% from from just in 1 month, and 27% increase in wage demand from last year. So we can see the shock adaptiveness of the program. It's able to respond to the needs. And I think the other interesting thing is that if you look at the states out of these various federal states, one of the states which has come up with the maximum demand for work is the state of Uttar Pradesh. And last year, it in the normal circumstances was 6th in terms of creating wage work for people. So really badly, and this is a state, UP and Bihar, which supply the most migrant laborers all over India. So you can see that immediately from 6th position last year, it has jumped to 1st position. And similarly, you see states that have come up forward this year were the states which were not depending that much on MGNREGA, which have now started accessing it in response to this pandemic. Next slide, please. Now, what are the key challenges? Now, this sudden demand of almost about 80 million, I'm sorry that number is wrong, 80 million workers coming home to, how do you look at it? These are guys with different skills. Anna talked about digital skills. Some of these are plumbers, machinists, delivery boys, chefs. So so I think the first response is just to give them immediate work before they can look for more skilled work. So this is one challenge, to deal with such big numbers and be able to provide them immediately work. Otherwise, these people usually were not just aspirational people, maybe 20%, 80% were more like people who, out of the stress and the family's need, move from farm sector to non-farm sector employment in urban areas. So if they're now going to be depending a lot back on the households and in the villages on fields, then how do you really de-risk this? So this is one challenge. So therefore, the other important is also, there are works where, however hard you try, the social distancing is not possible. It requires people to actually work as team. So we are working also to try and identify which works can be done immediately with social distancing norms. The safety norms for MGNREGA were always there, but this now adds totally new aspects in terms of masks. And so there's been, the good part is that it allows within MGNREGA, there is budget to buy these things as a percentage, and this is being accessed in different states. I guess the biggest challenge is, even if you have given guidelines, created works which do allow social distancing based public works, how do you really monitor this? You can't do this with satellites, you can't do it with a one photo taken, you don't know when, and after that people are again jumbling together. So this is an area where we are again working to find simpler solutions. And I guess the biggest one is what Anna mentioned, and also what I shared, is that this is the first tsunami wave. We know the other ones. The drought will come, the flood will come. So how do we now get more people packed into rural areas, more vulnerable than before, to become more resilient to these? So these are some of the areas where some of the planning work that we've done on GIS-based planning would help. The governments are also responding, and on the right-hand side, you will see that the government of Uttar Pradesh that I talked about has said that all MGNREGA families who have come forward to be an active worker will get free food, free rations. In Haryana, another nearby state which is more industrial and also has forest and W lands, there the government has said that the entire forest department will now use PWP work from MGNREGA, and public works and a lot of other departments are now actively, just as the case of Devin Pillis examples as well, are now using the MGNREGA labor in a convergence format. Next slide, please. So this is what we've been doing, and this is what the government is trying to do as well. I must say though that this is just one part of the story. So on one side is this whole social protection response and making it, creating flexibility within its own structure to absorb new requirements and more people, but also to create new ways of working with other departments to create new places, new opportunities to work. But I think in a rural area like India, it's also important that unless this is also side by side leading to reforms in other sectors, which also support for movement of this suddenly shocked labor force and human beings into next stages of economy and growth, then that is very important. So therefore, the changes that are happening side by side being pushed by COVID into the whole agriculture sector reforms, into the industrial reforms, and some level of injection and stimuli being given to small and medium industries. So this, we would have to see this all in synergies and together, and whichever does stay. So MGNREGA, good response, good way to immediately take care of shock and make sure that people don't starve, they have work to do, and they're able to create new assets. But the additional load of people who can again move back, that would be attracted by the other sectors coming in. There have been a number of government announcements on that. So I think overall, as a social protection perspective, things are being discussed. Different states are taking different levels of and different dynamics and different energies around their decision. And I think that is the space to watch in India, how different states respond to this. So thank you very much, and over back to you.
Thank you, Rajiv. That was a very interesting presentation as well. Great. So now we move to the Q&A session. We've received many interesting questions. We're gonna have to select a few. So let me start with a question that has been addressed to Mr. Devin Pillay, and it's about, so you talk about how the EPWP has expanded into different, or it's also planning to expand into different activities, no? And so the question is about how are people trained to perform these new tasks? Is the program delivering the training? Is someone else who is doing that? And how is this covered with the existing budget? No? Over to you, Devan.
Thank you. I was just busy typing in a response to that, but very quickly, every EPWP program by design embeds training, and the training is linked to the activity that is to be performed. So if the participants are recruited, the first few days of their participation in the program is linked to training. So the training could be theoretical plus experiential, or simply theory, or on its own on-the-job training. Now, we've had fairly large successes with EPWP when it comes to training. A further key element within the EPWP training is to gear participants to enter the formal economy. So we train a lot of them to go into to establish SMMEs or establish cooperatives. Really good successes in that area. There's a lot of training that's been done on the agricultural side towards food security. On the infrastructure side, there's ongoing continuous training on the various programs and projects that participants are employed on. And the difficulty we find, though, is although we do the ongoing training and participants to some extent are fairly well skilled in their areas, due to the nature and structure of the South African economy, which is not labor absorbing, we find that people are recycled within EPWP, so that once a project is finished, they move on to another, they get recruited into another project. So they kind of remain within the EPWP frame program until they're able to be absorbed by the economy. So if you look at a participant may be trained in a number of areas. So they could be from the trained in the social sector, environmental sector, and infrastructure sector. And although they have this large scope of training, they're not absorbed into the economy simply because of the structural nature of the labor market. But essentially, training is a critical element of EPWP, and the first few days are spent on training activities. Thank you.
Thank you, Devan. Now let me share another question with Rajiv this time. So you talk about people working in individual private infrastructure creation projects, no? So the question is about what kind of control mechanisms are there in place, or is the program put in place to control this type of individual private infrastructure creation?
No? So first of all, the individual private construction also has to be approved in the Gram Sabha, the local government body. So actually, the system, what happens is, if you, as an individual person, there are clearly what are defined as specific works with clear defined what is the output, what will be the wage component, how would it be calculated, how much money would be paid for what. So there's a full structure of each activity that is to be done. This is defined for materials and contexts of each state, in each state. So there's an empirical nature of it. Second part is that once I say that I want to do land leveling, I want to do farm bund improvement, how many meters, that is measured, and there's therefore a number to it. How much will I get? How many days of wage am I allowed to do? And most importantly, even these activities are then shared in the village assembly, where all activities are approved, and these are also approved. And these are also then scrutinized or part of the social audit process as well. So there is a way to how these are managed on the ground. Yeah, does it answer the question?
Yes, thank you very much. Good. So now, Anna, so there is a question about food security, in particular about what the good practices in terms of how public work programs can support food security, which is, of course, going to be a key issue in the near future.
Thanks. I think in terms of food security, food security has always been a core aspect of public employment programs. A lot of the assets created in public employment programs have been assets intended to promote food security. So there's been a lot of focus on kind of infrastructure like access to irrigation, ponds, terracing, these kind of activities. So historically, there has been this link, and I think Rajiv mentioned some of the initiatives linked to that in India. But they've been tending to look at very localized production. And I think that the question is more from Gabriel Fernandez, it's more about a global food security crisis in South Asia and Africa. And I think the issue is that I think we can learn from NREGA on this, because what happened there was that the public works employees were actually linked into national strategies to address environmental issues, to address food security issues. So instead of having ad hoc interventions, which were based on quite a limited menu of possible food security assets that could be created, the public works employees were actually used to implement national or state level strategies. So I think what we need to see is much more joined up thinking and using public works programs as mechanisms for implementing national strategies relating to food security, environmental adaptation. And I think that is actually the key issue, because there's been a lot of fragmentation. If we look at many programs, the assets, the interventions are selected by local communities in isolation from broader development plans, district development plans, state development plans. And I think some of these key interventions about linking public works into strategic, nationally led programs of work to address national priorities is really important. And so, yeah, I think learning from NREGA on that would be important.
Okay,
just
great.
to add, Anna, to what you said, because of India embarked on a very ambitious target of housing for the houseless by 2022, and the money available within the housing ministry was not enough, and actually almost 60% of the labor contributed for developing or building houses in the rural areas comes from MGNREGA. So I think so these are. But I think we need to move to even a grander scale, as what you said here.
Good. Let me share one last question, I think, quickly. So there is a question about the fact that public works programs, they don't guarantee access to social security, social insurance. Yeah. So the question is about how can public work programs evolve and provide support not only to unemployment, but also in terms of access to social security and social insurance in particular. I don't know if any of you want to address this question.
I'm happy to just endorse the challenge. I mean, conventionally, people working in public employment programs don't contribute to social security programs because they tend to be the kind of workers who aren't well placed to do that, and there aren't mechanisms for contributions from these kind of workers who are primarily informal workers. I know the ILO has been doing some experimentation in a couple of programs looking at whether contributory aspects could be included into the payment of the wage. But if then you're starting to do this, it becomes a much more complex endeavor in terms of the whole administration. So it's quite problematic to try and do that. So I think what we've seen is two things. If you want to actually offer social protection through public employment programs, they have to be available on demand as a form of employment guarantee. And that's when we look to the example of the NREGA, because that's the only program globally which really offers social protection, ongoing support on demand. And I think in the current crisis, when people are no longer able to work, that's the point at which you have to look at the interlinkage of different social protection instruments and shift them across to cash transfer programming. And that's the very practical response that you've seen in a number of countries. Either shift the caseload into cash transfer programs, or simply for this extraordinary period, pay the wage when people are in quarantine, if they're sick, unable to work. So I think there's ways of adapting the programs, and there certainly have been some countries that have experimented with that recently.
Okay, great. So let me ask a last quick question, which is a very interesting one, and is in particular to Devan and Rajiv, is in relation to the role of the private sector in identifying activities and providing training. No, we just have a couple of minutes, but I think it's a very interesting one. Devan or Rajiv?
Okay, I could go. Just to make sure that I've heard you correctly, you want to understand what has been the role of the private sector in public employment programs.
Yeah.
Okay, great. Well, in South Africa, it's quite sporadic. We've tried in the last 3 years or so engaging with the private sector to create work opportunities through their activities. Now, we worked with the mining sector, trying to develop a framework agreement, and there was fairly good success up until this particular point, and then it kind of sizzled off. You got to understand, if you don't have a bureaucrat on this case all the time and someone pushing it, there will be a point when a lull emerges, and once a lull emerges, it's very difficult to pick it up again. So we've had that experience within the mining sector. The second sector in which it was being investigated is what we consider the oceans economy, and that is looking at all of the activities around the ocean economies. Now that activity is still to be explored further. It's relatively new, and with the recent shift that's been happening within government policy, there hasn't been that much focus on the oceans economy as there was previously, but that's now beginning to change again. And once that changes, you will find EPWP a role across all sectors. That includes infrastructure because of the development that needs to take place within those harbors. You will find that in the retail sector, you will probably get EPWP participants employed, etc. To a greater extent, there has been success when working with the private sector on training initiatives. So there's a number of private sector initiatives where they provide training and they provide placements of participants thereafter into the private sector. So if you do look at my slides, I speak about the pharmacy program. What happens in there is EPWP participants are recruited. They are skilled in pharmacy work. Some of them may actually have qualifications. They then go and assist pharmacists, and over that period of time, they begin to get experience. So those kinds of initiatives are ongoing. You also have a number of initiatives in the IT sector. And remember, we're trying to gear the EPWP to be attractive to youth. While we want to attract 55% of youth, we're hovering around the 40% mark. So you need to find new activities that attract youth into the program. If you go to youth with farming activities, they're really not interested. They want to look at the newer economy activities that are emerging. So from a private sector initiative, I would advance that there is greater success when you look at the IT sector and you look at the training sector and you look at the financial sector. You get far greater absorption and far greater success in those areas. Thanks.
Great, thank you. I think we could talk a lot about this for a long time. It's a very interesting issue, but we've run out of time. So it's time to conclude. Let me start by thanking very much to Anna, Devan, and Rajiv for your presentations. It's been great. Let me also say that there were a few questions that we couldn't answer, so we are going to follow up with an email in a few days. And also mention that, as I said before, next week on Tuesday, there's going to be the webinar on identification and registration of beneficiaries, social protection beneficiaries in response to COVID-19. So please do register if interested. It's going to be a very interesting presentation. And that's all. Also, please do join the online community and the newsletter if interested. Thank you very much for joining us today. Thank you, Anna, Devan, Ajit. It's been a pleasure.
Thank you.
Thank you. Have a good week.